Ibuprofen is a medication used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. It is important to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes, so taking the wrong product could harm you. It is important to follow the recommended daily dosage and take ibuprofen at the optimal time for maximum effectiveness. When taking ibuprofen, it's important to follow the directions on the product package if it's over the counter, or the medication guide provided by your pharmacist if it's prescribed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take ibuprofen by mouth with a full glass of water, usually every 4 to 6 hours, unless directed otherwise by your doctor. It's important not to lie down for at least 10 minutes after taking this medication. If you experience stomach upset, it's recommended to take it with food, milk, or an antacid. The dosage of ibuprofen is based on your medical condition and response to treatment. To reduce the risk of stomach bleeding and other side effects, it's best to take this medication at the lowest effective dose for the shortest possible time. Avoid increasing the dose or taking it more often than directed by your doctor or the package label. For ongoing conditions like arthritis, continue taking ibuprofen as directed by your doctor. For children, the dose of ibuprofen is based on their weight. It's important to read the package directions to find the proper dose for your child's weight, and consult the pharmacist or doctor if you have any questions. For certain conditions, like arthritis, it may take up to 2 weeks of taking ibuprofen regularly to get the full benefit. If you're taking ibuprofen as needed, it works best if used at the first signs of pain. Waiting until the pain has worsened may result in the medication not working as effectively. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you're using the non-prescription product to treat fever or pain, consult a doctor if the fever gets worse or lasts more than 3 days, or if the pain worsens or lasts more than 10 days. Possible side effects of ibuprofen may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, inform your doctor or pharmacist immediately. If your doctor has prescribed this medication, it means that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, this medication may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes high. Seek immediate medical attention if you experience any serious side effects, such as easy bruising/bleeding, hearing changes, mental/mood changes, unexplained stiff neck, signs of kidney problems, vision changes, or symptoms of heart failure. It's important to note that ibuprofen may rarely cause serious liver disease. Contact a healthcare professional right away if you notice symptoms such as nausea/vomiting, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes/skin. While a serious allergic reaction to ibuprofen is rare, seek medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Ibuprofen, a nonsteroidal anti-inflammatory drug, has the potential to increase the risk of a heart attack or stroke, especially when used for a long time. This risk is higher for older adults or those with heart disease, high blood pressure, or diabetes. It is important to avoid taking ibuprofen right before or after heart bypass surgery. Another rare but serious risk of ibuprofen is the potential for serious bleeding from the stomach or intestines, especially in older adults. If you experience persistent stomach pain, black or tarry stools, or vomit that looks like coffee grounds, seek medical help immediately. It's important to discuss the benefits and risks of taking ibuprofen with your doctor or pharmacist. Always follow the recommended dosage and be aware of any potential side effects. Before taking ibuprofen, it's important to let your doctor or pharmacist know about any allergies you may have, as well as your medical history. If you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems, you should consult with a healthcare professional before using this medication. It's also important to stay hydrated while taking ibuprofen to prevent kidney problems, and be cautious about using alcohol or marijuana while taking this medication, as it can increase dizziness and drowsiness. Additionally, ibuprofen may cause stomach bleeding, so it's important to limit alcohol and tobacco use. This medication may also make you more sensitive to the sun, so be sure to use sunscreen and wear protective clothing when outdoors. For older adults, there may be a greater risk of certain side effects, so it's important to discuss the benefits and risks with your doctor if you are of childbearing age or if you are pregnant or breastfeeding. It's important to be aware of possible drug interactions when taking ibuprofen. This medication may interact with other drugs, increasing the risk of bleeding. Some examples of drugs that may interact with ibuprofen include ACE inhibitors, corticosteroids, and blood thinners such as warfarin. It's important to check the labels of all prescription and non-prescription medicines, as many medications contain pain relievers that are similar to ibuprofen. If you are taking low-dose aspirin for heart attack or stroke prevention, it's important to talk to your doctor about the best way to manage your medication. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen, and make sure to take ibuprofen at least 8 hours before or 2 hours after your aspirin dose. Always consult your doctor before making any changes to your medication routine. If you or someone else has taken too much ibuprofen and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or reach out to a poison control center at 1-800-222-1222. For residents of Canada, you can contact a provincial poison control center. Symptoms of ibuprofen overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. It is important to seek medical help if you or someone else is experiencing these symptoms after taking ibuprofen. If your doctor has prescribed ibuprofen, it's important not to share it with others. Your doctor may also order lab or medical tests, such as blood pressure or kidney function, while you are taking ibuprofen. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you are taking ibuprofen on a regular schedule and you happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, then it's best to just skip the missed dose and take your next dose at the regular time. It's important not to double the dose to make up for the missed one. As always, it's best to consult with your healthcare provider for personalized advice. Make sure to store ibuprofen at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes time to dispose of ibuprofen, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, it's important to handle medications responsibly to ensure the safety of everyone in your household. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.